Hello. So, one of the really important concepts that I do look at when I do patient advocacy, and especially if patients are in the hospital or have come home, is something called medication reconciliation. It is an accreditation standard, which means that hospitals, clinics, any kind of health facility that is open must abide by these rules and regulations. Reconciliation simply means that these facilities make sure that your medication and you know what they are and also that you get them and that they know what you took at home, what you're taking in the facility, and also when you get to go home, is it going to be the same or different, and that it's kept track of. If they miss something, then that can be a problem. So, how does this work? So, when you go to the hospital, usually they ask you, well, what medications are you on? So, at that point, it's really good to know what is the name, what is the dose, what is the route, how are you taking it, when do you take it, how often do you take it, why do you take it, and what are the side effects. And when they're changing your medications, you should know all of these things. Why am I getting this? What are the side effects? Are there any dietary restrictions? So, for example, certain anticoagulants, you can't eat green leafy vegetables. Um, what is the name? What is the dose? And what route am I taking? The reason this is really important is because when you go to the hospital, may decide to change some of your medications depending on why you're going to the hospital, and they may change it for your benefit. However, you need to be aware of that so that you're not looking for the normal medications that you normally take. The other reason is sometimes some things go missing and or they don't have that particular brand. So you want to make sure that are they giving me my regular medication or is it something else? And it's really important that these are covered because, for example, blood thinners, diabetic medication, seizure, anything to do with your heart, blood pressure, arrhythmias, antidepressants, anti-anxiety, and even pain medications. This is something that you're used to taking, so your body needs this, and especially when it comes to things like, for example, you're diabetic and you need your blood sugar taken care of. Now they may give you something else, but you need to be educated. Well, what is that? What does it sound like, look like, and how am I going to take that? And then when you go home, same thing happens again. They need to tell you, what am I taking? When am I going to take it? How am I going to take it? Where am I going to get it from? How often am I going to take it? Why am I taking it? And are there any restrictions or is there anything else I should look out for? And do I pick it up from pharmacy or do I can I continue taking what I have at home already? So this is all really important information that you know ahead of time. So meaning you can write these down. You have some people have little dosettes and it's already the medication's written on it, especially if you have a lot of meds. But if you don't, it's a good idea to write them down or keep a file somewhere so that when you need it, you have it and then you can share that information. And also to make sure that it is being followed up in the hospital when you're going from one unit to a next unit because sometimes things can go missing and this can cause a lot of grief for people and they may forget, they can misplace, or they can misread or forget. And this doesn't mean that they do it on purpose. It just means we are human and things can happen. But for your benefit, it is best that you know that these are your rights, but also these are their responsibilities and your responsibility. So we all make sure that everyone's taken care of. So make sure you know your medications, make sure that you know what you came with, make sure you know what you're going home with, and make sure you know where to get it and what the name is, why you're taking it, how you're taking it, what is the name, what is the dose, and why are you taking it? Are there any restrictions? I hope this helped. I'm trying to keep these videos nice and short. However, this is one of the more important ones, especially when people are on a lot of medications. So I hope this helped. Let me know in the comments if there are any other things that you would like me to talk about. Have a great day. Bye bye.